Imagine going to bed peacefully tonight, closing your eyes with the expectation of waking up tomorrow morning, but never opening them again. It sounds frightening, but for hundreds of thousands of older adults around the world this becomes reality every single year. Many people believe that when someone dies during sleep it happens simply because of age or bad luck. But modern cardiovascular research shows something very different. In many cases, the cause is linked to everyday nighttime habits that silently place enormous stress on the heart and brain while the body is supposed to be resting. According to data discussed by the American Heart Association, a significant portion of fatal cardiovascular events in adults over 50 occur during nighttime hours, particularly between late evening and early morning. During this period, the body undergoes several critical physiological changes. Blood pressure naturally drops, the heart rate slows down, hormones regulating repair processes become active, and the brain begins an important cleansing process known as the glymphatic system, which removes toxins accumulated during the day. Sleep is supposed to be a time when the cardiovascular system recovers from the demands of daily life. However, when certain habits interfere with this delicate balance, the night can become one of the most dangerous periods for the heart and brain. Many people unknowingly create conditions that increase the likelihood of heart attacks or strokes while sleeping. These habits often seem harmless. Some are part of routines people have followed for decades without questioning them. But science has begun to reveal how powerful their impact can be. Researchers studying cardiovascular risk factors have found that nighttime physiology is extremely sensitive to disruptions involving digestion, hydration, breathing patterns, medication timing, and even the temperature of the sleeping environment. When these factors are poorly managed, the body enters sleep already under stress, and that stress can trigger dangerous events in individuals whose arteries or heart are already vulnerable. A report discussed in cardiovascular journals analyzing patterns of heart attacks and strokes found that a surprisingly large number of severe events begin during the night or early morning hours. One reason is that blood pressure and circulation follow natural circadian rhythms. In healthy individuals, blood pressure decreases at night, giving the cardiovascular system time to rest. But when lifestyle habits interfere with this process, blood pressure may remain elevated or fluctuate unpredictably. These fluctuations can place sudden stress on arterial walls, sometimes leading to plaque rupture and clot formation. Another critical factor involves oxygen levels and breathing patterns during sleep. Conditions such as sleep apnea can drastically increase cardiovascular strain without the person even realizing it. Repeated interruptions in breathing cause oxygen levels to fall, forcing the heart to work harder and triggering surges in blood pressure. Over time this cycle damages blood vessels and increases the risk of both heart attacks and strokes. Yet breathing issues are only one piece of the puzzle. Nighttime digestion, dehydration, medication timing, and environmental temperature all interact with the body's cardiovascular regulation during sleep. When several of these factors occur together, the risk multiplies. The purpose of this discussion is not to create fear but awareness. Many nighttime cardiovascular risks can be dramatically reduced through simple behavioral changes. The most encouraging part is that these adjustments do not require expensive treatments or complicated interventions. They involve understanding how the body works during sleep and respecting the biological processes designed to protect the heart and brain. Over the next sections we will explore several nighttime habits that research has linked to increased cardiovascular risk. More importantly, you will learn practical strategies that can help your body enter sleep in a state of stability and protection rather than vulnerability. If you are over 50, this knowledge may be one of the most valuable pieces of health information you encounter this year. Before continuing, take a moment to interact. If this information is helping you understand your health better, leave a like because that simple action helps more people find life-saving information like this. Also write a comment saying, "I'm protecting my heart tonight." Reading your comments helps spread awareness and may motivate others to care for their health as well. And if you know someone, a partner, a sibling, a friend over 50, who should hear this information, share it with them on WhatsApp right now. You never know whose life this knowledge might protect. Now let's move forward and examine the first nighttime habit that science has identified as particularly dangerous for the heart during sleep. One of the most dangerous nighttime habits for the heart is something that millions of people do every single evening without thinking twice about it: eating dinner too late and eating too heavily before going to bed. At first glance this may not seem like a serious health risk. After all, dinner is simply another meal. But when you eat a large meal late at night, especially after 8 or 9 in the evening, your body is forced to remain in an active metabolic state during the exact hours when it should be slowing down and preparing for rest. Digestion is not a passive process. It requires significant energy from the body. When food enters the stomach, blood flow increases to the digestive organs. The stomach begins producing acids and enzymes, the pancreas releases digestive chemicals, and the intestines start moving food through the digestive tract. All of these actions require oxygen and circulation, which means the heart must pump harder and faster to supply the digestive system with the blood it needs. Instead of allowing the cardiovascular system to relax, a late heavy dinner forces the heart to remain in work mode deep into the night. Scientific research has begun to demonstrate how harmful this pattern can be. A large study published in the European Heart Journal in 2023 followed more than 100,000 adults over several years to analyze how meal timing affects cardiovascular risk. The results were striking. Participants who regularly ate dinner after 9 o'clock in the evening showed significantly higher rates of nighttime heart attacks and strokes compared with those who finished dinner earlier in the evening. In fact, the researchers found that late-night eating increased the risk of cardiovascular events during sleep by approximately 28%. The reason lies in how the body regulates metabolism and circulation at night. During the evening hours, the body's internal clock, known as the circadian rhythm, begins preparing organs for rest and repair. Hormones shift in ways that reduce metabolic activity and encourage the body to slow down. But when a heavy meal arrives late in the evening, it disrupts this rhythm. Blood sugar rises, triglyceride levels increase, inflammatory signals become more active, and the heart must continue circulating blood to the digestive organs long after it should have entered a restorative state. Another hidden danger of eating late involves acid reflux. When someone lies down soon after a large meal, stomach contents can move upward toward the esophagus. This condition, known as gastroesophageal reflux, can irritate the nerves surrounding the heart and sometimes trigger irregular heart rhythms. These disturbances may not always cause symptoms strong enough to wake a person, but they can still place additional strain on the cardiovascular system during sleep. There are also effects on blood pressure. Digestion stimulates the release of hormones that can temporarily elevate blood pressure and heart rate. If this occurs during the hours when blood pressure is supposed to drop naturally, the heart loses an important period of nightly recovery. Over months and years, this repeated strain can contribute to arterial inflammation and plaque instability, increasing the likelihood of a clot forming during sleep. Imagine a typical situation. A person finishes a large dinner at 10 o'clock at night, perhaps pasta, bread, meat, or fried foods. The stomach is full, digestion begins, and the body must remain metabolically active for several hours. Meanwhile, the person goes to bed expecting the body to rest, but internally the cardiovascular system continues working to support digestion. This mismatch between activity and rest creates stress on the heart and arteries. Fortunately, correcting this habit is one of the simplest and most powerful ways to protect cardiovascular health during sleep. Experts in circadian medicine recommend finishing the last main meal at least 2 to 3 hours before bedtime. For many people, this means having dinner around 6 or 7 in the evening rather than 9 or 10. The goal is to allow the digestive process to slow down before the body enters its deepest sleep cycles. The type of food eaten at dinner also matters. Meals that are lighter and easier to digest place less strain on the cardiovascular system. Lean proteins such as fish or chicken, vegetables rich in fiber, and moderate portions of complex carbohydrates such as brown rice or quinoa tend to digest more smoothly than heavy, fatty meals. Avoiding very salty, spicy, or greasy foods late in the evening can also reduce the risk of reflux and nighttime cardiovascular stress. Even a short walk after dinner can help the digestive system function more efficiently. Gentle movement stimulates circulation and supports the movement of food through the digestive tract without placing strain on the heart. Studies in metabolic health have shown that a 10 to 15-minute walk after eating can improve blood sugar control and reduce post-meal inflammation. This simple habit may help the body transition more smoothly into nighttime rest. When dinner occurs earlier and digestion finishes before sleep begins, the body can finally do what it is designed to do during the night: repair tissues, stabilize blood pressure, and allow the heart to recover from the day's demands. That recovery period is essential for protecting the cardiovascular system as we age. Now that you understand why late heavy dinners can place your heart at risk while you sleep, take a moment to reflect on your own routine. Do you usually eat dinner late in the evening? If so, consider shifting that meal earlier starting tonight. Small changes in timing can have surprisingly powerful effects on long-term heart health. If this information is helping you rethink your nighttime habits, leave a like because that small action helps more people discover life-saving health knowledge. Write in the comments, "Dinner earlier tonight." Seeing those messages encourages others to take action as well. And if you know someone who eats late every evening, a spouse, a parent, a friend, share this information with them on WhatsApp. Sometimes a simple message can protect someone's heart without them even realizing it. In the next section we will examine another nighttime habit that may be even more dangerous than late dinners, taking medications at the wrong time or forgetting them altogether. Another nighttime habit that can quietly place the heart and brain in serious danger is taking medications at the wrong time or skipping them altogether. For millions of adults over the age of 50, medications for blood pressure, cholesterol, blood thinning, or heart rhythm are part of daily life. These medications are not optional conveniences. They are carefully designed tools that help stabilize the cardiovascular system and prevent dangerous events such as heart attacks and strokes. Yet one of the most common problems doctors observe is inconsistency. Many people forget doses, delay them, or take them at times that do not match the body's natural rhythms. What many patients do not realize is that the timing of medication can be just as important as the medication itself. The cardiovascular system follows a powerful internal schedule known as the circadian rhythm. Blood pressure, hormone levels, heart rate, and blood vessel tone all change throughout the day and night according to this biological clock. In healthy individuals, blood pressure normally drops during sleep in a pattern known as nocturnal dipping. This drop allows the heart and arteries to rest and recover after the stresses of the day. However, in many older adults, especially those with hypertension, this natural drop in blood pressure does not occur properly. Some individuals experience what doctors call nocturnal hypertension, meaning their blood pressure stays high or even rises during sleep. This condition is particularly dangerous because it often produces no noticeable symptoms. A person may feel completely fine while sleeping, yet inside the body the arteries and heart are under significant strain. Scientific research has shown that nighttime blood pressure is one of the strongest predictors of heart attack and stroke risk. One of the most influential studies examining this phenomenon was published in the medical journal The Lancet. Researchers followed thousands of patients with hypertension and compared the effects of taking blood pressure medication in the morning versus taking it at night. The results were remarkable. Patients who took their blood pressure medication before bedtime experienced dramatically lower rates of heart attacks, strokes, and cardiovascular deaths compared with those who took the same medications in the morning. In fact, the study found that nighttime dosing reduced the risk of major cardiovascular events by nearly 45%. The reason lies in how the medication interacts with the body's nighttime physiology. When medication is taken before sleep, it provides protection during the hours when blood pressure can spike unexpectedly. This stabilizes the cardiovascular system during the period when arteries are most vulnerable to rupture or clot formation. But timing is only one part of the equation. The other major problem is missed doses. Skipping medication even occasionally can create dangerous fluctuations in blood pressure and blood chemistry. When medication levels drop suddenly, the body may respond with rebound increases in blood pressure. These spikes can damage delicate blood vessel walls and destabilize plaques that have formed inside the arteries over many years. When a plaque ruptures, it can trigger the formation of a blood clot. If that clot blocks a coronary artery, the result is a heart attack. If it travels to the brain, it can cause a stroke. Unfortunately, missed doses are extremely common. Surveys in cardiovascular medicine show that a significant percentage of patients forget their medication several times each week. Some people skip doses intentionally because they feel well and assume they no longer need the medication. Others simply lose track of time or forget in the middle of a busy day. But the absence of symptoms does not mean the condition is gone. High blood pressure is often called the silent killer precisely because it can damage the body without producing obvious warning signs. Imagine a scenario that doctors see far too often. A person takes their medication regularly for a few days, then forgets one evening. Blood pressure gradually climbs overnight. The arteries, already narrowed by years of plaque buildup, suddenly experience a surge of pressure. A fragile plaque ruptures, a clot forms, and within minutes circulation to part of the brain is blocked. By morning the person wakes up unable to move one side of their body. What makes these events tragic is that they are often preventable. Consistent medication use dramatically lowers the risk of such crises. Creating a reliable routine is one of the best strategies for maintaining consistency. Many physicians recommend linking medication to an existing nightly habit, such as brushing your teeth or preparing for bed. Pill organizers can also help by providing a visual reminder of whether medication has already been taken that day. Another useful strategy is setting a daily alarm on a phone or clock to prompt medication at the same time each evening. Of course, medication timing should always be discussed with a healthcare professional. Not every drug should be taken at night, and some medications require specific schedules based on individual medical conditions. That is why it is important to consult a doctor before making changes to medication timing. But once the proper schedule is established, consistency becomes one of the most powerful forms of protection for the heart and brain. Medication adherence does more than control blood pressure or cholesterol levels. It stabilizes the entire cardiovascular environment during sleep, reducing the likelihood of sudden spikes, clot formation, or dangerous rhythm disturbances. In other words, taking medication correctly creates a protective shield around the heart during the hours when it is most vulnerable. Now take a moment to reflect on your own routine. Do you ever forget medications or delay them until the next morning? If so, tonight is the perfect moment to change that pattern. Small improvements in consistency can dramatically reduce long-term cardiovascular risk. If this information helped you understand why medication timing matters so much, leave a like because that small gesture helps more people discover life-saving health information. Write in the comments, "I will never skip my medication again." Those words may inspire someone else reading the comments to protect their own health as well. And if you know someone who sometimes forgets their medication, a parent, spouse, or friend, share this information with them on WhatsApp today. A simple reminder could help prevent a life-threatening event. In the next section we will explore another hidden nighttime danger that affects millions of people without their knowledge: sleep apnea, a breathing disorder that can silently strain the heart and increase the risk of heart attacks and strokes during sleep. Another nighttime danger that many people live with for years without realizing it is sleep apnea. This condition has become one of the most underestimated cardiovascular risks in adults over 50. Sleep apnea occurs when breathing repeatedly stops and starts during sleep. In some cases the pauses in breathing last 10 seconds. In more severe cases they can last 20 or even 30 seconds. These interruptions may happen dozens or even hundreds of times during a single night. What makes sleep apnea particularly dangerous is that most people are not aware it is happening. While the body struggles for oxygen, the person remains asleep or only partially awakens without remembering it the next morning. Each time breathing stops, oxygen levels in the blood begin to fall. The brain senses this drop and immediately sends an emergency signal to wake the body just enough to restart breathing. This sudden activation triggers a surge of stress hormones, accelerates the heart rate, and causes blood pressure to spike. When this cycle repeats again and again throughout the night, the cardiovascular system experiences constant stress instead of rest. Over time, these repeated oxygen drops and pressure surges damage blood vessels and increase inflammation inside the arteries. The heart must work harder to compensate for the unstable oxygen supply, which gradually weakens its function. Researchers studying sleep disorders have found extremely strong connections between untreated sleep apnea and serious cardiovascular events. One large study conducted by researchers associated with Stanford University followed thousands of adults diagnosed with sleep apnea. The findings were alarming. Individuals with untreated sleep apnea had approximately 3 times the risk of experiencing heart attacks during sleep and nearly 4 times the risk of suffering strokes compared with individuals who did not have the condition. The reason for this increased risk is not only the lack of oxygen but also the repeated spikes in blood pressure that occur throughout the night. These spikes place intense strain on arterial walls. In people who already have plaque buildup inside their arteries, sudden pressure changes can cause those plaques to rupture. When a plaque ruptures, the body quickly forms a clot to seal the damage. If that clot blocks an artery supplying the heart or brain, a heart attack or stroke can occur within minutes. Another dangerous aspect of sleep apnea is that it prevents the body from reaching deep, restorative sleep stages. During healthy sleep cycles, the body enters phases where tissue repair occurs, inflammation decreases, and the cardiovascular system stabilizes. But frequent breathing interruptions repeatedly push the body out of these deeper sleep stages. As a result, the heart never receives the full restorative benefit of sleep. Over months and years, this lack of nightly recovery contributes to chronic cardiovascular stress. Recognizing the warning signs of sleep apnea is extremely important. One of the most common symptoms is loud, persistent snoring. While occasional snoring may not indicate a serious problem, heavy snoring combined with breathing pauses is often a key sign of apnea. Many people only discover this pattern because a partner notices that breathing stops temporarily during sleep. Another common sign is waking up gasping or choking during the night. Morning headaches can also occur because oxygen levels dropped repeatedly during sleep. Extreme daytime fatigue is another frequent symptom. People with untreated sleep apnea often feel exhausted even after spending many hours in bed. This happens because the repeated breathing interruptions prevent the brain from completing normal sleep cycles. There is also a strong connection between sleep apnea and high blood pressure that is difficult to control. In many patients whose blood pressure remains elevated despite medication, doctors eventually discover that untreated sleep apnea is the underlying cause. Fortunately, sleep apnea is treatable once it is properly diagnosed. Doctors typically confirm the condition through a sleep study, which measures breathing patterns, oxygen levels, heart rate, and brain activity throughout the night. These studies can be performed in specialized sleep clinics or sometimes at home using portable monitoring equipment. One of the most effective treatments for moderate to severe sleep apnea is a device called a CPAP machine, which stands for Continuous Positive Airway Pressure. This device gently delivers air through a mask worn during sleep. The airflow keeps the airway open and prevents breathing interruptions. Many patients experience dramatic improvements in energy levels and cardiovascular stability once they begin using this treatment. For individuals with milder forms of apnea, lifestyle adjustments may also help. Sleeping on the side instead of the back can reduce airway collapse in some people. Maintaining a healthy body weight can also improve breathing during sleep because excess tissue around the neck can narrow the airway. Avoiding alcohol close to bedtime may help as well, since alcohol relaxes throat muscles and can worsen breathing interruptions. Even something as simple as choosing the right pillow to support proper neck alignment may improve airflow during sleep. The important message is that loud snoring and breathing interruptions should never be ignored. They are not just annoying sleep disturbances. They can be early warning signs of a condition that significantly increases the risk of heart attacks and strokes during sleep. If you or someone close to you snores loudly, wakes up gasping for air, or feels constantly tired despite sleeping for many hours, it is worth discussing these symptoms with a healthcare professional. Identifying and treating sleep apnea can dramatically reduce nighttime cardiovascular stress and improve overall health. Now pause for a moment and think about your own sleep. Do you snore loudly? Has anyone ever told you that you stop breathing during the night? If this information makes you reconsider your sleep habits, leave a like because doing so helps spread this potentially life-saving knowledge to others. Write in the comments, "I will protect my sleep tonight." Seeing those messages can encourage others to take their health seriously as well. And if you know someone who snores loudly or constantly feels exhausted during the day, share this information with them through WhatsApp today. It could be the wake-up call that leads them to seek help before a serious event occurs. In the next section we will discuss another surprisingly common nighttime mistake that increases the risk of heart attacks and strokes. Going to bed dehydrated. Another nighttime habit that can quietly increase the risk of heart attacks and strokes is something that many older adults do intentionally because they believe it will help them sleep better: going to bed dehydrated. Many people avoid drinking water in the evening because they do not want to wake up during the night to use the bathroom. While the intention may seem practical, the physiological consequences of dehydration during sleep can place serious stress on the cardiovascular system. During sleep, the body continues to lose fluids through breathing and perspiration. Even though these losses are not obvious, they gradually reduce the amount of water circulating in the bloodstream. If someone already goes to bed with insufficient hydration, the blood can become more concentrated as the night progresses. When blood becomes thicker, it does not flow as easily through the arteries and veins. The heart must work harder to push this thicker blood through the circulatory system. Imagine trying to pump honey through a narrow straw instead of water. The thicker the fluid, the more force is required to move it. The same principle applies to circulation. When blood viscosity increases due to dehydration, resistance in the blood vessels also increases, forcing the heart to pump with greater effort. This increased strain can be particularly dangerous for individuals whose arteries are already narrowed by years of plaque buildup. In addition to increasing the workload on the heart, dehydration also promotes conditions that favor clot formation. Blood that flows more slowly and becomes more concentrated allows platelets and clotting proteins to interact more easily. If a clot forms and blocks an artery supplying the heart or brain, the result can be a heart attack or a stroke. Scientific research has begun to highlight how strongly hydration levels influence cardiovascular stability during sleep. A study published in the Journal of Cardiovascular Disease investigated the relationship between hydration status and nighttime cardiovascular events. The researchers found that moderate dehydration significantly increased the risk of cardiovascular complications during the night. In fact, individuals who were dehydrated before going to sleep had approximately a 65% higher likelihood of experiencing nighttime cardiovascular events compared with those who maintained proper hydration. One reason dehydration becomes especially dangerous at night is that the body's heart rate and blood pressure naturally decrease during sleep. This reduction is part of the body's recovery process. However, when blood becomes thick due to dehydration, the slower circulation can further reduce oxygen delivery to vital organs. This creates a situation where the heart and brain may receive less blood flow precisely when the body is already operating at lower pressure levels. Dehydration also influences the balance of electrolytes in the blood, particularly sodium levels. When the body loses water without replacing it, sodium concentration in the bloodstream can rise. Elevated sodium levels can trigger the release of hormones that increase blood pressure and promote inflammation within the arteries. Over time, this inflammatory environment contributes to the progression of atherosclerosis, the buildup of plaque inside blood vessels that leads to cardiovascular disease. Consider a common scenario. An older adult finishes dinner around 6 in the evening and decides not to drink anything afterward because they do not want to wake up during the night. By the time they go to bed several hours later, their hydration levels have already begun to decline. During the night they continue to lose small amounts of fluid through breathing and perspiration. As the hours pass, the blood becomes more concentrated, circulation slows slightly, and the risk of clot formation increases. In someone whose arteries are already vulnerable, this situation can create the conditions for a stroke or heart attack while they are asleep. Fortunately, preventing dehydration at night is simple. The goal is not to drink large amounts of water immediately before bed but to maintain balanced hydration throughout the evening. Many health experts recommend drinking a glass of water about 1 to 2 hours before going to sleep. This timing allows the body to absorb the fluid while still giving the bladder time to empty before bedtime. Using the bathroom immediately before lying down can also help reduce the likelihood of waking during the night. Keeping a small glass of water on the bedside table is another helpful habit. If you wake up during the night feeling thirsty, taking a few small sips can restore hydration without overloading the bladder. These small adjustments help maintain healthier blood viscosity and support smoother circulation throughout the night. Proper hydration also supports the production of saliva and mucus that keep the throat and airways moist, which may reduce irritation and improve breathing during sleep. Another advantage of balanced hydration is improved temperature regulation. Water helps the body maintain stable internal temperature during sleep, which supports deeper and more restorative rest. Deep sleep is essential for cardiovascular recovery because it allows the heart rate to slow and reduces inflammatory activity within the body. It is important to understand that hydration is not only about the amount of water consumed but also about the overall balance of fluids throughout the day. Drinking adequate water during the morning and afternoon reduces the need to consume large quantities in the evening. When hydration is distributed evenly throughout the day, the body enters the night in a more stable physiological state. This balanced approach helps protect the cardiovascular system while still minimizing nighttime bathroom interruptions. Now take a moment to consider your own evening routine. Do you avoid drinking water after dinner because you are worried about waking up at night? If so, you may want to rethink that strategy. A small glass of water in the evening could help maintain healthier blood flow while you sleep. If this information helped you understand why hydration is so important for nighttime heart health, leave a like because that simple action helps spread this knowledge to people who may need it. Write in the comments, "I will hydrate before sleep." Those words might inspire someone else reading the comments to protect their own health. And if you have a friend or family member who rarely drinks water in the evening, share this information with them on WhatsApp today. A small change in hydration habits could make a meaningful difference in their cardiovascular health. In the next section we will explore another surprisingly powerful factor that affects the heart during sleep: the temperature of the room where you sleep. It may seem like a simple comfort issue, but the environment around your body during sleep plays a powerful role in how the cardiovascular system behaves throughout the night. When the bedroom is too hot or too cold, the body must work harder to regulate its internal temperature. That extra effort may not seem dramatic, but during sleep the heart and blood vessels are supposed to be resting and recovering. When the body is forced to constantly adjust its temperature, the cardiovascular system remains under stress instead of entering a restorative state. Temperature regulation is one of the most energy-demanding processes in the human body. When the surrounding environment becomes too warm, the body attempts to cool itself by expanding blood vessels near the skin. This process is called vasodilation. As blood vessels widen, blood flow to the skin increases so heat can escape through sweating. While this mechanism helps regulate temperature, it also forces the heart to pump faster to maintain circulation. For a healthy young person this may not create serious problems, but for older adults whose arteries may already be stiff or partially blocked, the increased workload can place additional strain on the heart. A study conducted by researchers at Harvard University examined how nighttime temperatures influence cardiovascular stress. The findings revealed that sleeping in environments warmer than 24 degrees Celsius significantly increased cardiovascular strain and was associated with a higher risk of heart-related events during the night. In hot conditions the heart rate rises, the body loses fluid through sweat, and blood pressure may fluctuate unpredictably. These factors combined can create dangerous conditions for people with underlying cardiovascular disease. Excessive heat also contributes to dehydration, which as we discussed earlier can make the blood thicker and increase the likelihood of clot formation. When dehydration and elevated heart rate occur simultaneously, the risk of circulation problems increases even further. But extreme cold can also create its own set of cardiovascular challenges. When the environment becomes too cold, the body activates protective mechanisms designed to conserve heat. Blood vessels constrict in a process known as vasoconstriction. By narrowing the blood vessels near the skin, the body reduces heat loss and directs blood toward vital organs. While this helps maintain core temperature, it also increases resistance in the circulatory system. As resistance increases, blood pressure rises because the heart must pump harder to push blood through the narrowed vessels. For individuals whose arteries are already hardened by years of plaque buildup, these sudden increases in blood pressure can be dangerous. Research conducted across several European countries has shown that cardiovascular deaths often rise during periods of extreme cold. In fact, some studies indicate that the risk of heart attacks increases significantly during cold waves, particularly during nighttime hours when the body is already vulnerable. The combination of vasoconstriction, increased blood pressure, and reduced circulation can create conditions that trigger cardiovascular events. The key to protecting the heart during sleep is maintaining a stable and moderate bedroom temperature. Most sleep researchers and medical experts recommend keeping the sleeping environment between 18 and 21 degrees Celsius. Within this range, the body can regulate its internal temperature efficiently without placing unnecessary strain on the cardiovascular system. When the room is within this comfortable range, the heart rate remains more stable, blood vessels function normally, and the body can enter deeper stages of sleep that promote recovery and repair. In addition to adjusting room temperature, there are several practical steps that can help maintain a healthy sleep environment. Good ventilation is important because fresh air helps regulate humidity and temperature levels. Opening a window slightly or using a fan to circulate air can prevent the room from becoming too warm during the night. In colder climates, using appropriate blankets instead of dramatically increasing room temperature can also help maintain a comfortable environment without overburdening the cardiovascular system. Choosing breathable bedding materials may also improve sleep quality. Fabrics that allow heat to escape help prevent overheating during the night. This is particularly important for older adults who may be more sensitive to temperature changes due to reduced ability to regulate body heat. Another helpful strategy is maintaining a consistent sleep schedule. When the body goes to bed at similar times each night, the circadian rhythm becomes more stable. This stability improves temperature regulation and supports the body's natural nighttime cooling process, which is essential for deep sleep. The body naturally lowers its core temperature as part of the sleep cycle. If the surrounding environment supports this cooling process rather than fighting against it, the cardiovascular system can relax more easily. Even small environmental adjustments can make a significant difference. A room that is too warm by only a few degrees may increase heart rate and dehydration, while a room that is too cold can trigger blood pressure spikes. Finding the right balance helps the heart remain calm and stable throughout the night. Now take a moment to think about your own bedroom environment. Is the room often too hot during summer nights? Or perhaps too cold during winter months? Making a few adjustments to maintain a stable temperature could be one of the easiest ways to protect your heart while you sleep. If this information helped you understand how something as simple as room temperature can affect your cardiovascular health, leave a like because that action helps more people discover life-saving health knowledge. Write in the comments, "I will improve my sleep environment tonight." Your message might motivate someone else reading the comments to take care of their health as well. And if you know someone who sleeps in a very hot or very cold room, share this information with them on WhatsApp today. Sometimes small environmental changes can prevent serious health problems. In the next section we will bring everything together and discuss a simple nightly routine that can dramatically reduce the risk of cardiovascular events while you sleep. Now that you understand the 5 nighttime habits that can silently increase the risk of heart attacks and strokes, the most important question becomes, what should you actually do every night to protect your heart and brain while you sleep? The good news is that the solution does not require complicated medical treatments or expensive equipment. In most cases, protecting your cardiovascular system at night comes down to building a simple and consistent evening routine that respects the natural rhythms of the body. The human body functions best when daily activities align with circadian biology. When meals, medications, hydration, and sleep occur at predictable times, the heart, brain, and blood vessels are able to regulate themselves more efficiently. Scientists studying circadian medicine have repeatedly shown that stable routines improve cardiovascular outcomes and reduce inflammation throughout the body. One practical way to implement this is by creating a structured nighttime schedule that gradually prepares the body for rest rather than forcing it to suddenly switch from activity to sleep. For example, beginning the evening with a lighter dinner around 6 or 7 in the evening allows digestion to progress before bedtime. Choosing foods that are easy to digest, such as lean proteins, vegetables, and moderate portions of complex carbohydrates, prevents the cardiovascular system from working overtime during the night. After dinner, gentle movements such as a short walk can support digestion and improve blood circulation without placing strain on the heart. Research in metabolic health has shown that even 10 to 15 minutes of light walking after a meal can help stabilize blood sugar and reduce inflammation. As the evening continues, maintaining proper hydration becomes important. Drinking a glass of water during the early evening ensures that the body enters sleep with balanced fluid levels while still allowing time for the bladder to empty before bed. Balanced hydration helps maintain healthy blood viscosity and supports smooth circulation through the arteries. For individuals who take medications related to blood pressure, cholesterol, or blood thinning, the evening routine should also include taking these medications at the time recommended by their physician. Consistency is essential because regular dosing helps maintain stable cardiovascular protection throughout the night. As bedtime approaches, the environment of the bedroom should be prepared in a way that supports the body's natural cooling process. Adjusting the room temperature to a comfortable range between 18 and 21 degrees Celsius allows the body to regulate its internal temperature without forcing the heart to work harder. Adequate ventilation, breathable bedding, and proper blankets can all contribute to a more stable sleep environment. For individuals who snore or suspect they may have sleep apnea, sleeping on the side rather than on the back may help maintain clearer airways during the night. Proper pillow support that keeps the neck aligned with the spine can also improve breathing and reduce strain on the airway. Before lying down, it is helpful to empty the bladder and complete nighttime hygiene routines such as brushing teeth. These small steps reduce the likelihood of sudden awakenings and help signal to the brain that the body is ready for rest. Once in bed, the goal is to allow the body to enter sleep gradually without unnecessary stimulation. Avoiding bright screens and intense mental activity during the final hour before sleep can help the brain produce melatonin, the hormone responsible for regulating the sleep cycle. When the body falls asleep naturally, the cardiovascular system can enter its restorative phase more effectively. During deep sleep, heart rate slows, blood pressure stabilizes, inflammation decreases, and important repair processes occur within the brain and blood vessels. These restorative processes are essential for maintaining long-term cardiovascular health. Research published by the American Heart Association emphasizes that high-quality sleep plays a critical role in reducing the risk of hypertension, stroke, and coronary artery disease. In other words, sleep is not merely a passive state of rest. It is an active period of recovery that allows the heart and brain to repair the damage accumulated during the day. By protecting the conditions that allow deep sleep to occur, proper meal timing, hydration, medication consistency, healthy breathing, and stable room temperature, you create an environment where the cardiovascular system can recover each night instead of struggling under additional stress. Think about how powerful this knowledge is. The changes required to reduce nighttime cardiovascular risk are not extreme. They involve simple adjustments to daily habits. Yet these small habits repeated night after night can influence whether the heart receives the rest it needs or faces additional strain during sleep. Thousands of people suffer nighttime heart attacks or strokes each year without realizing that many of these events could have been prevented through basic lifestyle awareness. The difference between risk and protection often lies in the habits practiced every evening. Now that you know these 5 critical habits to avoid and the routine that protects your heart, the most important step is taking action. Knowledge alone cannot protect you unless it becomes part of your daily life. Starting tonight, consider implementing these changes. Eat dinner earlier, take medications consistently, maintain hydration, ensure healthy breathing during sleep, and create a stable sleeping environment. Your heart and brain will benefit from these small but powerful adjustments. Before you leave, take a moment to interact. If this information helped you understand how to protect your heart while sleeping, leave a like because that simple action helps this knowledge reach more people who may desperately need it. Write in the comments, "I'm protecting my heart tonight." Your message may encourage someone else reading the comments to take their health seriously as well. Also consider subscribing so you can continue learning practical, science-based strategies that help protect health after 50. Finally, think about someone you care about, a partner, a friend, a sibling, or a parent who might not know about these risks. Send this information to them on WhatsApp right now. A simple message could help prevent a tragedy and allow someone you love to wake up healthy tomorrow morning. Remember, information has the power to save lives, but only when it is shared and applied. Take care of your heart tonight, sleep peacefully, and wake up ready for many more healthy years ahead.